Hello, everybody, and welcome to our webinar today. The title of this webinar is Urban Mobility in the New Normal, the Challenges and Opportunities in the Midst of the COVID-19 Pandemic. So we will have up to an hour and a half for this webinar, and I will introduce our guests in just a moment and explain the format of the webinar. First, I want to hand this over to Eduardo Zdanovic from Brazil, who's also a part of the IHS Alumni Board, to just tell us a few words about the webinar series.
So hello, everyone. Here in Brazil, I'm connecting from São Paulo. It's in the morning, but probably in the other parts of the world, it's already evening. So welcome to our webinar. This is a series of webinars that we've been doing for the past 3 years. This is one of the last webinars that we have on our board as a board, because the IHS Alumni Board will change. But we are happy to participate and to organize this important discussion. You can check all the previous webinars on our website, makingcities.nl. I will post here the link on the chat later on. And of course, this session is being recorded. So if you have any problems with the connection and then you miss anything that was said, just watch after the replay link. And also, of course, if you need to leave earlier or you're connecting a bit after, don't worry, everything is being recorded. I also would like to say that if you have any technical issues, like something's not happening well, like the audio or the connection, just let us know, and then we will be glad to assist. So I just thought, just since back, like this can also happen sometimes. We are like doing our best and working from each one of our homes, but this kind of issues can happen, okay? And I also would like to thank Stefanie for helping to organize this session, and also to my colleagues on the board, besides me and Justin, Nancy, and Jano.
Okay, thank you, Eduardo. Thanks a lot. Yes, Eduardo, and in particular Janu from the Alumni Board, have been running quite a lot of webinars over the past few years, and they've been quite good. So we hope to be able to live up to the expectations. If there are any of you who have watched some of the previous ones, we've had a lot of good ones, and I think there's another one coming up as well. So with that, I would like to get us started. So just to mention, we have 3 of us will be the guests here. So I'm a co-host and also one of the speakers. So we have Alan Vera, who's an international consultant based in Santa Cruz, Bolivia, and he currently works for the CAF, Development Bank Latin America, on improvements in planning the bus rapid transit system. And he's also an alumnus of the IHS Master's Program back in 2008-2009. And then we have Stefanie Holzwarth. She is a sustainable urban mobility expert for the UN, and she works with the UN Habitat Office in Nairobi, Kenya. And she is currently engaged with the Urban Pathways Project. Now, each one of them will tell a bit more about themselves. I just wanted to give you a quick information on who's on. I'm Justin Hyatt. So I am a member of the outgoing board of the IHS Alumni International for the 2017 to 2020 board period. And my position with the board has been the network and community builder. So that's just very briefly about who we have on this webinar. And I wanted to explain a bit about the format of the webinar, because it will be a bit unusual. So what we decided to do is we want to have a more informal discussion. So we won't do the traditional, question and answer presenter and just going through a lot of questions and answers or just a presentation. But we want to have this more as a conversation, a discussion, where we'll start with the 3 of us discussing 3 particular question. So I'll read out the question, and then we'll each discuss the question and then we'll go on to the next question. And then after we've just discussed these 3 questions as the, let's say, the start to the discussion, the start to the topic, we'll then open it up so everybody who wants to can jump in and both ask questions or also make comments. So you are very welcome. Don't be shy. You're very welcome to come on live. You can ask there's a function, as far as I understand, if you push the hand button in the webinar system, then you have the opportunity to mention that you want to say something. So it's the speak request. So we hope that this system will work. So in any case, we intend to allow everybody who wants to ask a question or to make a comment by pressing the speak button. And if either it doesn't work for some reason, or you'd rather not show your face today, maybe it's very early in the morning where you live, then you can also send a question or a comment in the chat function, which is also one of the opportunities here in the Webinar Jam. You can send a question or a comment, and then we'll read them out. So you have both of those ways to participate. And remember, we are just having a discussion with each other, and we want to dig into the topic. So yeah, that's about this. And let's see. Before we start the first question, I wanted to give the 3 of us a bit of a chance to say in his or her own words who we are. So Stefanie, you've popped back up. Do you want to just quickly mention anything about yourself?
Yes, Justin, I would like just to remind everyone, if you have any technical issues, sometimes it's your own internet connection, so you can try to restart the session. So just close the window that you're using and just go back. Sometimes it's just about that. And if you lose anything, like I said, there is the replay link, and then you can watch afterwards, okay?
All right, so I'll take the opportunity to introduce myself. My name is Stefanie Holzwarth, and I work for the United Nations Human Settlements Program, in short, UN Habitat. We are headquartered in Nairobi in Kenya, and since more than 5 years, I have been engaged in providing technical advice, knowledge, and advocacy to governments around the world on sustainable urban mobility. Previously to my engagement with UN Habitat, I had worked for GIZ in urban development projects in Egypt and Cape Town. And on top of that, I'm a very passionate cyclist. I regularly also join open street events, and yeah, I would call myself a bit of an advocate for cycling as well. I'm not an IHS alumni, but we are co-organizing this webinar, and I would like to thank the other organizers for the opportunity to do that together. Thank you.
Thank you, Stefanie, and I'll have Alan, if you can introduce yourself a bit more. But before you do, I just wanted to add that, Stefanie, that's correct. In fact, we do have UN Habitat as the co-organizer or the co-promoter of this webinar. So I'm sorry I forgot to mention that at the beginning. Thanks for filling us in with that.
Yeah, thank you, Justin. Thank you, Eduardo, and thank you, Stefanie. I'm going to introduce myself. My name is Alan Vera. I'm now here connected from Santa Cruz, Bolivia. I'm really happy to be part of this event. I believe the IHS alumni community was eager to hear something about urban mobility, especially about sustainable urban mobility and relationship with the COVID-19 pandemic. So I'm really happy to be part of it. I am an architect. I used to be a former IHS student, UMD 5 actually. Then I made my master's there. And also after that, I specialized in urban mobility, in road safety in Belgium, in Singapore, in some other parts of the world, and also in South Korea. And in my country, I used to work for the national government, for the local governments, as director of several projects there, trains, buses, cable cars. And now I'm helping the municipality of Santa Cruz to develop a BRT project, and also a private company to develop also a new bus system. I'm really, really happy to be here and hoping to learn and share some of my ideas and some of my experiences as well. Thank you.
Thanks, Alan. Okay, So let me just also give you a few words about myself. So as mentioned, I am on the outgoing alumni board of IHS, and I was also a master's student. I did my master's at IHS from the year 2015-2016, and I am otherwise, my main work currently is for the Car-Free Cities Alliance, which is an international organization and network for cities and for people who who see car-free as an important topic. So I'll of course be sharing more about that later. A bit of my background. So before IHS, I spent a lot of my time in Budapest, Hungary, where I started to work on urban mobility issues. I was quite closely involved with the Budapest Critical Mass movement, which was, let's say, the largest critical mass ride, had the largest rides anywhere in the world. That's an amazing story. I'll be happy to talk about that if we don't run out of time. I also did various other work with NGOs and helped start a few different initiatives myself. And doing that in Budapest, Hungary, also some similar things and topics in Tunisia, where I lived for a while as well. And now I'm currently living in Spain. So that's just sort of very, very quickly in a nutshell. And yeah, let's jump right into the first question. And I will ask Stefanie to be the first person to talk and share a few slides. Let me read out the question to you. So here's the first question. And also, because the format again, because we will first be discussing this, the three of us, and then we will open it up for everybody a bit later on. So if you have specific questions to each of the questions, you can put them in the chat, or you can also note them down, and then we can discuss them later on. So we definitely want to give anybody who wants to discuss enough time to do that. Okay. How has COVID-19 affected urban mobility systems, and what changes have we already seen taking place this year? What are some of the places and leaders who deserve to be recognized for seizing the moment and doing good things? That's our first question, and you can start, Stefanie.
Yeah, thank you so much, Justin. Yeah, so with the lockdowns, the movement restrictions, and the working from home arrangements, we have seen that the streets in our cities started to empty themselves of cars and of buses. We have also seen that the need for transport has dwindled as people and more people needed to stay at home. I would like to share how this has affected, let's say, our mobility behavior. I'm going to share an example from Belgium. 1 second, I hope this works. Start the presentation. Can you see my slide?
Not yet.
Not yet. Now we do, yeah?
Yes.
Super. Okay, so this slide shows the change in the mobility behavior at the time of, the ease of the lockdowns. We have seen that in Belgium, public transport had gone down by 16%. Biking and walking have gone up instead by 40% and by 20%. Whereas if we compare the Belgium context with Brussels, we can see that in Brussels, public transport usage went down by 45%. That data was collected by Kantar in, I think, around June or July. And I felt it was a very good insight in kind of understanding how COVID has changed some of our mobility behaviors. Initially, public transport has always been seen as a vector of the disease, and especially in developing cities where UN Habitat is also very much engaged in. Public transport tends to be formal, and therefore we do face issues of overcrowding in a very confined space, and the risk of infections was always a bit higher. That's also connected to the often poor upkeep of those public service vehicles. But recent data, which has been discussed also by the International Association of Public Transport, has shown that this assumption has to be questioned, that public transport is always a vector, because they could not strongly correlate rise in infections with public transport usage by the time the public transport was utilized again by the time the lockdowns were eased. So I do believe that there is opportunities for making public transport services safe and transport mode that can be used even now. What has also become obvious, I think, from the COVID pandemic is that public transport has provided a lifeline to many. All our cities were tasked to provide priority access, especially to those people that needed it most, in terms of an affordable means of movement, but also in terms of a safe means of movement, for example, if it's workers of essential services and so on. So in most of our cities, we remained with some of the public transport services, even in times of the high peaks of the pandemic. What we have also observed is that, especially in low-income countries, very often people live on hand-to-mouth jobs for their livelihoods, and it was very difficult for those countries and those cities to really close down the city movements, and those people were then forced to expose themselves to high risks of infection in overcrowded public transport or also in streets. Just to share an example of Nairobi, where minibuses form the backbone of the public transport, we did see that the sector was very much financially struggling. By the time the occupancy needed to be reduced by 50%, that was based on a government directive, and public transport in form of those minibuses, they also needed to cover for additional expenses for safety and hygiene measures, such as providing sanitizers and so on. What we have seen is that additional expenditure had been very challenging for those minibuses, and very often, made it difficult for those minibus operators because they already had a very limited profit margin.
Stefanie,
yes.
Did you stop sharing your slides?
Yes.
Okay, sorry. I just was not showing anymore.
Yeah. I am starting again. Next. You can see the slides again?
Yes.
Okay, super. Some other governments have also opted to promote walking and cycling as affordable alternatives to public transport, and many cities started improving their facilities for walking and cycling, which contributed to better short distance mobility, to better overall health, and also a stronger immune system of the people in those cities. We do know of examples such as Bogota, Lima, Berlin, or Milan, but there is also other, maybe not as famous examples, such as Belo Horizonte, Addis Abeba, and Nairobi, who allocated a public right-of-way from cars to people, and allowing those people then the opportunity to walk and to cycle on a safe space because there was sufficient infrastructure. I would like to share a few examples on those cities. Here you can see the city of Belo Horizonte in Brazil, and you can see in red the additional cycling infrastructures, I think in total something like 30 kilometers that they have implemented as part of their COVID response. It was a very interesting process where the government had collaborated with the civil society stakeholders, and they literally went for a bicycle ride through the city to identify the locations where additional infrastructure, pop-up bicycle lanes would make sense. Here you can see that some of the bicycle infrastructure was planned either on a carriageway for the cars or even on the parking lane of the cars, which I think is quite a message that states that space is given to the cyclists and the pedestrians away from the cars and to provide more space for those safe modes. Here you can see how it looked in terms of practical implementation. This is an example where the space had really been taken from the carriageway on the left side and on the right side from the parking space. What I found very interesting is that statement from Evelyn Prado, who is the coordinator for sustainability and environment. So really the brain in the local government behind that initiative. And she said, all the local newspapers released articles about the cycling network with a very positive focus. Thus, despite being in a very difficult moment due to the pandemic, we had an excellent opportunity to get the bike back on the agenda, which has fulfilled us with hope at this moment. I think Belo Horizonte is really one of those cities that has inspired us, and it's also one of our partner cities. I'm going to share another example from Cape Town, where a civil society group had come together and started a campaign that was called Heroes on Bike. They're called Culture Cycles, and they collaborate with the Lanka Bicycle Hub. And what they did was also very amazing, because they provided healthcare workers and essential workers with bicycles to get safely to their jobs and fulfill their duties in times of the pandemic. Another example that I would like to share is from Ethiopia. Ethiopia on the 3rd of June this year had released its non-motorized transport strategy, and since has also, let's say, emphasized the importance of non-motorized transport, walking and cycling as part of their COVID response, and they are already in the process of implementing this strategy. And the last example that I would like to share is from Nairobi, from Kenya, where also the government and the local government had started implementing non-motorized transport facilities for people that walk and people that cycle, to provide them with a safer means of transport during the pandemic. I think those examples are quite inspiring, and are definitely some good examples to also learn from. The last thing that I want to mention is that COVID-19 has completely impacted on the already fragile finances of the transport sector. And I think therefore many cities also looked for low-cost and quick implementation measures. There has been countries where public transport ridership has gone down by 90% in hard-hit countries like, for example, China or Iran. And this has led to almost no revenue generation of the public transport sector, which I think caused quite some challenges in terms of remaining with some and maintaining some of the operations. As cities limp back to the normalcy, I think public transport will have to play a major role in the economic recovery, as it provides a low-cost mode of mobility for the majority of the population, in combination with promotion of walking and cycling. And I think governments now need to find ways to offer income support or even tax exemptions to public transport operators, for example, and ensure that we are not losing the accessibility and the connectivity in our cities in a post-pandemic world. Yeah. With that, I would like to hand back. Thank you.
Okay, thank you, Stefanie. Let's see if Alan, are you ready to jump in with your comments or your discussion for this question?
Yeah, thanks, Justin. I'm going to start the slides. Can you see it, right? Can you see it?
Yes, it's on.
Fantastic. Okay. Well, in order to answer the first question, I would like to say just a comment, right? I mean, I believe that new normal requires not only new public health safety measures, it also requires a new urban mobility, one that needs to be resilient, to tackle the pandemic challenges, which I believe they should be considered as opportunities more than just challenges. Okay. The pandemic context. The pandemic is not over, even though in some parts of the world the lockdowns or the quarantines are going to be suppressed or be changed. I believe it's not over yet. Public transport service have been extremely effective. The quarantines are implemented, as I was saying, and suppressed in different parts of the world and cities. But what ends up with this is that we have less cars, we have cleaner air, and we have safer streets. The picture that I'm showing in this slide shows, for example, an advertisement of the Bolivian government that was saying that after going to the hospitals, the next most risky thing to go was or to use was transport, the public transport. So was the message that was told to people was to avoid using public transport. That's why, to answer the first question, I want to focus more on public transport. So in this sense, if we are promoting to avoid public transport, to avoid being contacted with COVID-19, I believe that some issues should come about. For example, are we going to move less? Are we going to move in different times? Massive transit is over, or should we make a less massive transit? The use of motorcycles and private cars would be more intensive, or it's time for the use, for example, of bicycles. I'm showing you this picture. The source is moving. It shows how the use of public transport in different cities in the world has been changing from the time that COVID-19 was let's say like released in media. So as you can see here, the curve is showing that the use of public transport has really declined in all of the world. The next slide shows, for example, some recovery in some Asian cities. It's a comparison between Singapore, Seoul, and Hong Kong. And as you can see, there has been some recovery in some months, some recent months, but it's not actually the same as it used to be. So we should, or may argue, that the new normal will have to also consider that the new use or new demand for public transport has been changed a lot. This picture shows, for example, the recovery of use of public transport and also the use of private cars. It is a comparison between the United States and Brazil. And as you can see, public transport, the line which is in purple, it's not recovering as fast as the recovery of the usage of privately car. And as you know, that is sad, because we've been promoting that people get out of the private vehicle cars and to use public transport are now not seeing the real results of that, because public transport is being seen as a risky place, as a risky activity, I would say. So that's a shame. And of course, as you can see, in several parts of the world, I mean, there's like policies to prevent to be conducted with the COVID-19. So it is mandatory to use masks, and you can see, for example, a picture from the Tokyo Metro, and also you can see a picture of a bus in the, I believe, no, a train in Kolkata, India. So it's a difference of usage, right? In the first image, you can see that all the people is using masks, and the next one you see that maybe one or two persons in this picture is using really masks. So it shows us the difference also in the culture. It's about if people really obey the law or not. Now, in this picture, you see, for example, a way that some public transport system are trying to clean or to making these efforts to have a better vehicles. I mean, prepared to avoid, that people get contacted with the disease. Also, in this picture shows, for example, that some other means of transportation, like cable cars, and also are developing this kind of less use of the vehicles. For example, a cabin of a teleférico that should be full of 10 people now can only transport 4 people, for example. Some other picture that shows, for example, the informal sector, and in this sense, you can see that these operators have been struggling and being put effort to be part of this new normal, as implementing some healthy measures, like only carrying out the 50% or 40% of their capacity in the vehicles, and also to avoid the use of the contact, the direct contact, by using the fare system. They do not have fancy fare collection system. They are still using or collecting money from bills and coins, but they develop these kind of barriers in all their vehicles so that people can put the money in these pockets of that you can see they're in plastic, so that the contact is avoided. So it is even safer. If we talk about also the leaders of this movement that is being changed because of the pandemic, we can see that also this pandemic has bring about an opportunity to use streets in a better way. It's like giving back the city to the citizens. No? So because of the close down, because of the quarantines, the vehicles were not allowed to use the streets. So the people that reclaim their space, because as you know, streets are public space. So I'm now sharing these examples from several parts of the world when you can see that people are using this.
Alan, I mean,
yeah.
Are you still there, Alan?
Yeah. Can you hear me? Hello.
Yes, I can hear you.
Yeah.
Okay.
Yeah. So that will be like almost the last of the part of the.
I can continue if with what I was going to say, if we don't get Alan back on in just a second here.
No, Justin, I can hear you. I can
you.
hear both of you.
Eduardo, you can hear me, right?
Yes. Okay, so we can hear people in the chat are also.
So I think I will go ahead and then make some comments, and if we get Alan to come back on, then
then
we can let Alan finish what he was saying for this first question. Okay. I just got a message that maybe it's my problem that people can hear Alan, so I'll let Alan keep speaking.
But now, okay, let's just wait a few minutes. Sorry for this problem. Let's see. Sometimes the connection can vary and then can have some delay, you know. So that's why Justin maybe thought that Alan wasn't on. Let's just wait a few minutes here. Sorry. Yes, Carolina is being recorded. Sorry for the inconvenience. We are facing some technical issues here, and we will go back in a few minutes. Maybe Justin. Oh no, we have Alan back here. Let's just okay. Alan's here. Justin, Alan's here. Hello, Alan. Can you turn on your microphone, please?
Yeah. Hi.
Okay. So we have some technical issues. I will go back to your slide presentation. Okay.
Please.
All right. Sorry for the problems. We are.
Yeah. Back. Thank you, Eduardo. So I was saying, I want to also share this the last picture of this part of the answer of the questions to show some good examples of usage of public space, since I believe people were just recovering back what has always been theirs, right? Public space. So it's like giving back the streets to people and not giving back the streets to vehicles. So. Also, if we want to talk about good examples of the international good examples, I would say, of course, Barcelona in Spain is a good example, Berlin, Milan, Paris also. But if we see some example from Latin America, I would highlight Lima, for example. I would highlight also Bogota in Colombia, because they're developing cycle paths lanes and pop-up bicycle lanes, for example. I wanted to also show in the second answer of the second question, and also want to also share with you that there's been a good policy that has been implemented or was trying to be promoted in Ecuador, in Quito. So they were just promoting the idea of giving subsidies for public transport operators, covering all tariffs for passenger use. In that sense, the income would remain for public transport operators, and the passengers that have a difficult economy would not have to pay for the use of public transport. So the municipality was trying to pay or to cover all the expenditure of using public transport. So in that sense, the reduce of the demand, or to carry out just the 50% of the capacity of a bus should be like covered with the money of the municipality. So that's a good thing. The other good thing is that the people that use the public transport would not have to pay for the use of the service. They would go or use that by free, because the tariff will be being taken care of by the municipality expenditure. So I think it's a good policy that's been like a pilot project in Ecuador, and I believe it's like an innovation that they've been implemented there. So it's a best practice that I think it's good to share with the audience in this event. Thank you.
Okay, hello everybody, and thank you, Alan. Sorry for the technical glitch earlier. At least I could not hear Alan, and so I found out that I was interrupting. I didn't mean to interrupt you, Alan. Sorry about that. So yeah, I think it's best if everybody, three of us who are not speaking, just turn the video and microphone off. So, and then we'll jump back on when we're going to say something. Okay, good. I wanted to just give a few comments myself on this topic, and I'll try to keep it short so that we will have enough time later on for the discussion with everybody else. I also wanted to mention that when we go to the second and third question, I'd like to ask everybody, myself included, to keep the comments rather short, just so that we can then all talk also with the participants. We have right now over 100 people, so we want to give people the chance to say something. So to answer the question, so I basically just wanted to mention a few things that I have noticed and that I've seen during the COVID-19 pandemic this year. So some of the things that I've seen in mobility and what has struck me. So first of all, there are some specific places which stand out to me, which are the first places that I heard about that wanted to do something different. So quite early on, I think in April, we already started hearing things like build back better. You know, the idea to not go back to business as usual and to use the crisis as an opportunity to change how systems in cities work, how mobility systems work, infrastructure, and so forth. And I heard the first thing from Milan in Italy, which was one of the heaviest hit countries and regions of the pandemic, that they said right away that they wanted to change their city, and that they wanted to use this opportunity to do something different. And in fact, I'll just read a quick quote from the deputy mayor of Milan, Marco Granelli, because it seems to me that he really caught the essence of the idea. So what he said was the Milan plan, and that the plan was to convert a lot of streets to cycle-friendly streets, to more pedestrian amenities, and to make it much more friendly streets, and to remove a lot of the car traffic. So he said the Milan plan is so important because it lays out a good playbook for how you can reset your cities now. It's a once-in-a-lifetime opportunity to take a fresh look at your streets and make sure that they are set to achieve the outcomes that we want to achieve. Not just moving cars as fast as possible from point A to B, but making it possible for everyone to get around safely. And this is something that I want to come back to in one of the later questions. So we've had a lot of cities that started to say the right things and that they want to change. They made declarations that they're going to do something new and different and better. And I think a good thing to look at in our coming up questions is like how much of that is really something that we can expect to happen in the future, and which of these things sounded good and were maybe good ideas, but are a bit slow with the follow-up. So, for example, other cities, which have said that they want to do big things. London, England, wanted to convert a lot of the streets into pedestrian-only streets, and they wanted to make big changes in the downtown of the city. Paris also, and in fact, the mayor of Paris had some quite, hang on a second, had some quite amazing things that were mentioned. In fact, the mayor, Anne Hidalgo, she wants to put bicycle lanes on all the streets of the city and remove 60% of the parking spaces, which is 45% of all the parking in the city. So again, some very ambitious ideas, and the question is how far will these cities actually go in implementing some of the visions? Stefanie has mentioned that there are a lot of cities that are not just, let's say, in the European orbit or North America, but cities in other parts of the world. And yeah, also I know that I've heard that Kampala, Uganda, did a ban on cars entering certain parts or maybe all of the downtown areas. I've heard good things not only from Ethiopia, which Stefanie mentioned, but also from Bogota, Colombia, and other places. I mean, and even in Europe, in the eastern part of Europe as well, like Tirana has the mayor who spearheaded a lot of like immediate response to the pandemic and created some things. And I just want to give a few pictures of this. So pop-up, so a bunch of different things, which, hang on a second. A bunch of different things. Can you see my slides?
No, your slides are not. Let me just put it here for you.
Here. Yeah, here we go. Yeah. Okay, so I wanted to just show a few pictures of some of these changes that have happened. So this is a pop-up bike lane, and by pop-up bike lane, we're talking about very quickly done infrastructure. So very cheaply and very quickly done infrastructure. This one is in Budapest, Hungary, and this is the city I used to live in. And when I lived there, it was always my dream to have a bike lane on this road. This is the ring road around in the main part of the downtown, which has a huge amount of traffic, both car traffic. It has the busiest tram line in the world. It's basically the heart of the city. And so to have a bicycle lane there, I never dreamed it would happen, but now that happened. And let's see, this is in Berlin. They've also had a lot of pop-up bike lanes. And the thing that I wanted to point out here is that, I mean, what they've put here, it's very effective and very cheap. So, I mean, just to put up some of this infrastructure, you can do it overnight. The question is what can be made permanent, and then, but nonetheless, it can be done right away with the hopes. Many people hope that they will be made permanent, but those are some of the, let's say, the struggles ahead. Yeah, here's a picture in Paris where they converted one street, the Rue de Rivoli. They converted that basically to a pedestrian and cycle street. So a lot of nice things like that. And I wanted to just show a few pictures in Rotterdam, in the Netherlands, where I've previously lived. Also some very nice responses, quick responses. We have here some paint on the street. This is one of my favorite things. These are picnic benches that were put in public areas. So if you haven't noticed, a lot of times in cities, the only available place that you can actually go to outside are cafes and restaurants where you have to go and you have to pay to be there, basically. Whereas this allowed people just to come I mean, I would come down here with my own cup of coffee, read my book, whatever I wanted to do. So not only in this, like in a square like this, but even on parking places were converted to have picnic benches like that. So a lot of great stuff like that, and further like sort of pop up little parklets and things. This year is another part of Rotterdam where they cut off the access for cars, but they allowed a ride through for cyclists. So yeah, stuff like that is quite interesting. And of course, the question is, what can become permanent, or these are some responses which are very very exciting for us who work with mobility. But we would like to know, how can they be made permanent, and how can more permanent, like long-term transitions take place? So I think, yeah. So what I've heard is that these kinds of measures, like 150 cities I read, have actually done things like this, pop-up bike lanes and so forth. So 150 cities around the world, maybe more. At least that's what some information that I have. And yeah, so the question is, what can become a longer-term vision or solution? And that takes me to my next, or to our next question. And we will indeed try to go a bit quicker from now on, because we do want to then bring in everybody else. So question number 2, what opportunities does this crisis have for us to create long-term change in the way we do mobility, or the way that cities work? What would be our ideal scenario? And now I would like to ask Alan if you could be the first person to jump in.
Thank you, Justin. So I would say that from a planning perspective, our generation is privileged to witness this kind of developing moment in history, because, as you know, sometimes crisis would allow us to move things forward. So, for example, the pop-up like bicycle lanes is like idea that have been here for a long time, but there was not a moment that allowed us to really implement it. So the idea was there, but because of this crisis, it took us the opportunity to develop them. So I see that the challenges of the COVID-19 pandemic has bring to along a need to be like taken as opportunities. I was saying, for instance, the appearance of this new infrastructure, for example, for bicycles, and also if you see the widening of streets that has been implemented in Barcelona, for example, I like them a lot. So I think these kind of two like small examples would need to be permanent, but would not be permanent if we do not develop real policies for them. So I do believe that the policy should be really equitable. So they should take in account all users, all citizens, like people with disabilities, elderly, children, etc., etc., so that this project will not only benefit some part of the society, but benefit the whole of society. So I want to share some, just maybe 3 slides, so that we can start the presentation. Okay. Stop. Oh, I went back to the one that I had before. Sorry about it. Now, maybe the next one. Yeah, I want to just show you, for example, that this used to be a video, but unfortunately, because of the format of the event, I cannot show you the video. But it was like an example of a good project developed in Paris, as Justin was saying. And in this case, I want to show you some picture of some behavior, I would say, of the healthy personnel that we have, of the health personnel that we have in my country. For example, it was a lockdown, it was a quarantine, but even though that, the nurses and the doctors have developed ideas to just reach in places. So in this case, this nurse was going to work using her bike, even though there was not a bike lane. So it became famous because of like promoting sustainable transportation and not polluting air, not using private cars, but using bicycles, for example. That's a good thing. They also developed some pop-up bicycle lanes in my city, in La Paz. So as you can see, this is one of the main streets there. So one like half of one of lane of this avenue was taken to be used as a bicycle lane. So it was like a permanent measure, but I hope it would remain in time. Some positive innovative actions, I would say, like the widening of streets, as I was telling you about in Catalonia, but also a not so good innovation actions. For example, it was a concept for cars in Aarhus, Denmark. And I was really surprised because I really believe that Danish had really good, knowledge about sustainable development and everything. But these kind of innovations, I would say in quotes, are not things that we would promote, because it's promoting also the use of private cars. So it's like giving the opposite of the message, right? I want to also end up answering the question, saying that I believe that the ideal scenario should be to develop also regulations, because as you know, only policies, national policies, regional policies, and also municipal policies, we don't have clear regulations that really promote that the focus or that the priority should be taken to the people instead of cars that would not actually reach the point. No? That was the ideas I wanted to share in this part of the event. Thank you.
Okay, Stefanie, do you want to say anything to the second question?
Yes, thank you. I think Alan already mentioned quite a few of the issues, but what I would also like to emphasize once more is that the ideal scenario is definitely not going back to the individual car-based transport. Instead, we need to focus on promoting public transport and walking and cycling much more through policies and through quick implementation. I think one of the lessons learned that we can take from the way that, for example, pop-up lanes were implemented is that the implementation happened very quickly. You had mentioned before, literally sometimes overnight. And I also believe that there has been less hierarchies and less bureaucracy in implementing those ones, because solutions needed to be found quickly and immediately. So there might be some lessons learned to take from the way that we have done things during the pandemic in a rush and with less hierarchies and less bureaucracies, that we could maybe also, and maybe also with the right partnerships, I forgot to mention that, between, for example, governments, science, and the civil society, which I think are very important, which we hopefully can also be embark on in the future. One additional point that I would like to make is that COVID has also totally changed how we are, how we need to move in cities, and I hope that employers will provide enhanced opportunities for the staff to continue with teleworking, for example. That has reduced commuter traffic in cities, but I also believe it has really reduced, for example, air traffic, and we have found new ways of connecting and walking together that do not necessarily need a daily trip in a city. And with that, I think what has become very important is this concept of 15-minute neighborhoods. It's a concept that has existed before, but I think it has become more and more important in times of the pandemic, because many people were remaining in the houses and were relying on those daily services in an accessible distance. So I think that's one of those concepts maybe where we could look to Paris. The mayor of Paris has promoted the 15-minute neighborhood plan in order to reshape the city for many years, and I think it's really an example that we should be learning from in the time when we're opening up our cities again. Yeah, that's it.
Okay, thank you, Stefanie. So I'll just, a few things. So like what would be the ideal situation is something which actually is a gripping question for me quite often when I think about like what would be great to have. And so Stefanie, as you mentioned, at Paris, where they had these ideas for several years, and then now they were able to take them in a faster way. I think that's one of the interesting things that I've also noticed during this period, is that those cities that had already had a leadership, progressive in nature and wanting to to create more livable cities for their citizens and for the people who live there, have used this opportunity to start to do that, to start to build that. So it's like a lot, it's like they realized, okay, this is our moment where we can do something, and then they already took steps forward, and so I think that's great. Of course, not every city in the world has the opportunity to have great leadership, and that's why also it's quite important for citizens to ask or to demand that things should be changed and should be improved. So myself, representing the Car for Cities Alliance, like when I look at the future vision of a city, what I think would be amazing, it would be to have a really dramatic reduction of car use in cities, and where possible, elimination. I think it's actually quite feasible to have cities that operate even without cars completely. We have a good guide in the book by J.H. Crawford, Car Free Cities and Car Free Design Manual, which is what we base a lot of our work on, and which basically takes answers all the technical questions on how could you design a city that doesn't use cars. And I mean, of course, cars or vehicles, will be needed in cities, whether it's for emergency vehicles or for other kinds of things. But there are ways to really dramatically or drastically change how cities are built. And really, the goal is to have a place for people to live, to families, children, elderly people, so for everybody to have a place for people to be able to live and enjoy being in the city, and not to always live their lives in danger. So anyways, I think most everybody listening to this webinar already knows the great benefits that something like that would have. I just wanted to add one thing that I think that while we mentioned in the last section, we talked about these quick solutions that have happened. Like what my hope is that when we have these quick solutions like pop-up bike lanes, that we can merge that together with a more fundamental shift in systems. So a systemic shift in how things work, and that's not only in the infrastructure, but that's also in the mentality and in the way of thinking of people. So that for example, like right now, if we talk about car-free cities, while that might sound quite extreme or extravagant, that that if we have this system thinking shift, what it will mean is that people will become more aware of and more willing to go in on such topics and such ideas, and it won't be such a science fiction anymore to have a city which is a livable city, which is a car-free city. Anyways, I said that I wanted us to be quicker, so I'll stop there and go on to the third and last question. And then, again, we'll try to keep that short and then open it up for everybody else who wants to come in. So the third question is, what are the best opportunities for real systemic change? What will it take to convince governments to overhaul the system and commit to a transition program? Who are the players or networks that can make this happen? Okay, so now I will just take the word again for a few minutes, and I will also put on a slide. I don't think it's visible yet. Okay. So what I was basically saying, so what I want to say now is in continuation of what I said before. So we've had a lot of cities or leadership in cities say that they want to change things. Some have already started to change things. But my fundamental question is, for this last part, how can we actually get things to change in the long term? How can we bring about a longer systemic change in the way that mobilities work in cities? That's our website. Sorry, I'm just going to jump ahead because we don't have that much time. So here's something that I wanted to refer to. This is during the early part of the pandemic. I listened to a really excellent presentation by a biologist named Daniel Wall, and he talked about regenerative cultures. And what really resonated with me is, let me just read this what it says here. So, crisis is a terrible thing to waste. It's time to end subsidies for fossil fuel and build decentralized renewable energy systems. And we need leadership at the bioregional community scale. We need global solidarity and cooperation, and we need to redesign our dysfunctional economy. So this is kind of like a whole bunch of stuff at once. And as far as I understood his approach, it is that there needs to be a global cooperation or partnership among a lot of different levels and among a lot of different people, organizations, networks, and so forth to bring about this change. So it's something that has to happen, that we need to happen. And the question is, what are the ways that it can actually come about? So how do we push this forward, not just in incremental ways, but really quickly? Because I mean, if we look at what the scientists tell us in regard to climate change, we really do need to change our lifestyles and the way our economy works, the way our business is done very quickly, or we will hit a catastrophe situation. So I've just scanned a few different international networks, and a lot of different networks, organizations are getting involved at this time. They are coming forward with some ideas that they want to do. So, for example, the EU has a lot of different programs. I mean, they're all the hang on a second. So there's a lot of budget which is given to rebuilding. There are a lot of programs like the EU's EIT urban mobility plans, which wants to make a handbook for cities. The UITP, which is a public transport body based in Brussels, they have their own Build Back Better Mobility Manifesto. We have the World Economic Forum talking about a nature-first approach to business and to rebuilding business economy and to doing a recovery. The OECD has its own Build Back Better approach. So all these big international organizations are talking about building back better. But at the same time, I think that the threat is really actually quite big, that the dominant forces in politics and society will try to bring back the old ways of doing business. So that's basically what is my question is how can the good idea of what we want versus the threat of what could happen. So how do those work together, and how can these forces of trying to bring us on a transition time scale, how can we allow that to happen, or how can we be a part of that? So that's basically my interest here, and I would like to go on to let's see, Alan, if you want to continue.
Thank you, Justin. I want to see if my slides continue with the last part or not. Let me just check one. Oh, come on. Now, you know what? I want to do this. Sorry about it, but I need to. Can you see the screen, right?
Yes.
Yep.
What is happening?
Okay.
What is happening?
You know what?
We are switching slides, so that's why.
Yeah, but in this case, I'm just going to show these two slides, please, so that to answer directly. Yeah, don't worry. Sorry, Eduardo. So in order to answer the question number 3, I want to say sorry that we should do like building back better, as what Justin was saying, but we also need to really rethink the way we are planning the cities, right? We should develop livable neighborhoods, for example. We should promote all the activities. We should promote also open air commerce in order to avoid this kind of spread of the disease. The 15-minute tea that was Steffi was referring earlier also, it's of course a need. And also we also they take care of the opportunity that we have like three main, like say, like international mandates. We have to develop and to implement the SDGs, as you know. We have like 10 years, and this is the last decade, so it's the implementation decade, as the UN says. So especially the SDG 11, for example. We have the new urban agenda, that is the following of the what has been decided in Quito, in Ecuador, several years ago, is developing also a new way of doing urban development. And also, of course, as Justin was saying, the relationship with climate change and all the COPs that have been developing until now. So this picture is a picture taken in Ghana, in Accra, I believe. So as you see, this is plenty of activity street. I really like it, and of course, it's a picture that has been taken before the pandemic. So can you imagine if after the pandemic and after all that we've been developing and making efforts, we can improve this part of the city? Do not take in the activities that have been implemented here, but to develop a better, a more equitable space for example, people with disabilities, for elderly people. So I think this opportunity that we have at the pandemic of the COVID-19 give us the chance to build up better. So my final consideration for this should be to let's transform the emergency and its challenges in opportunities. Quarantine should be permanent, but for private cars, not for people. And let's give back the city to pedestrians. That's it. Thank you.
Thanks. Go ahead, Stefanie.
Yes, I really liked what Alan was just saying. Quarantines for cars should be permanent. I'll note that down. To answer the question, I think already quite a few things have been said, but I think what is very important is that we do look at transport in a more holistic manner. I think one of the things, at least that I have learned from COVID, is that you very quickly notice that transport is linked to very many other sectors, such as climate, such as our economy and how we move in our cities, how we do trade, how our societies function, and so on. And once transport might not be as available as before, we might be struggling with a few of those things, or we might see improvements on some of those things, such as pollution and emissions and so on. So I think what I believe we have learned is that we need to look at response partnerships that do integrate all the different stakeholders, so really including governments and especially also looking at different departments in governments, linking energy, environment, transport departments, health departments, and so on to each other and work together on solutions. But we also need to look out for more multi-sector partnerships in the sense that we integrate more the transport sector in the decisions that the government comes up with. We need to look at international development partners, and Justin, you have mentioned very many good efforts before where we can learn from the best practices. We need to look at sustainable financing from development banks, which I think is an important aspect, and make sure that that financing that comes in will be directed towards sustainable mobility and not towards more highways and more flyovers in our city. And we also should, I think, recognize the role that civil society can play. I think they have really been active also in pushing for those, for example, pop-up bike lanes and helped even in implementing and painting them. So I think also a bottom-up approach is very important. And the last point that I want to make is that for a real systemic change, I think it's also important to make more use of science and medicine insights and also public health insights when we do our urban and mobility planning, because they can provide us with the data and the numbers that we need to inform our policies and to convince our decision makers to show that change is needed. We can also evaluate our current practices and would notice that many of those current practices haven't been very sustainable, but then utilize that data to convince the decision makers to bring forward more impactful policies in the future. Thank you.
All right, thank you. Yeah, so I think the three of us have really talked long enough, and I don't know how long everybody can stay on. We still have some more time. Let's open it up for anybody who wants to speak or to share. And now I'm quite interested to know how it's going to work. Let's see if somebody will be able to come on directly. I'm accepting the hand requests. Okay. Let's see. Can somebody please, if you want to say something, hit the hand request again, and let's see if we can get you live. Or then, if not, then just ask a question through the chat. Okay, I see Abir has joined. Go ahead.
Yes. How are you? I'm Abir Salem. I'm a student urban development and technical university in Berlin. And I would like to share something related to my master's thesis. My master's thesis actually implemented a blue-green infrastructure, which is one of them, that's a transportation analysis. The transportation analysis systems in Krakow city in Poland. What I noticed, but not in this country, I noticed that in my country, Egypt, Cairo, we have a new solutions to decrease the minutes to arrive for a point, or from point to point to arrive for what you want. So the first thing what I noticed is that we are decreasing the green areas to improve the transportation idea, like make bridges, lots of bridges, and these bridges somehow that improving for the transportation side, but from other sides that make harming for the nature, because we decrease the green areas. So what you are supposed about other countries has the same situation. Now, if we wanted to improve the mobility in the city, and that can maybe because the limited spaces in the city, and the city have already limited spaces to transportation. So when we already add another infrastructure like lanes for bicycles, maybe that would ask to decrease the green areas from other side. So what do you think? This is aside, and we should consider it in our points also, beside what we already talk about as improving for mobility.
Yeah, thank you for the good question.
Yeah.
Does anybody want to comment on that? Okay, Stefanie, do I see you speaking? I can't hear you.
Okay, no, I wasn't.
Yes.
I wasn't.
Oh, good.
Yeah, thank you so much for that question coming from Egypt. I think especially you probably refer to Cairo, which has an insane traffic congestion problem.
Yeah.
And I think what is important is to look at the carrying capacity of the different pieces of transport infrastructure.
Yeah.
And I think especially Cairo is a city where we have a lot of highways that do cater for private cars, but lesser for example, public transport and non-motorized transport in form of walking and cycling. So what might help is to redistribute street space according to the carrying capacity. And if we would do that, we would definitely see that, for example, a separated lane for a bus rapid transit system or a bicycle lane would be able to carry much more people in an hour per direction than, for example, a lane for a car. So maybe, I mean, I'm not exactly sure what context you are referring to, but it might be also a matter of reflecting on the distribution of the space according to the carrying capacity of the different transport modes.
Yeah.
Yeah, in my case, you know, in addition what Stefanie was correctly saying, I also would recommend to think about new means of transport. I'm a huge fan of cable cars, for example, and I do believe that in some contexts they are really useful. But you have also to take in consideration the context and the geography and everything. But it would be a good solution because an urban cable car do not fool your carrying capacity of the streets. It's a new way of transportation that's in the air. So it will be also a good solution for some parts of the city. That's it.
Yeah. Thank you.
Thanks, Abir. And I see that Shail Shrestha from Nepal is here too. And I'll just mention that Shail is a colleague of mine at the Car Free Cities Alliance. So I'm looking forward to your comments or questions.
Okay, hello. Am I being heard?
Yes.
Okay, yeah. Particularly about the last question about how we can go ahead with this. I think one of the very important concerns that most of us have is if the impact of the COVID crisis is going to stay longer in our minds, you know, like with the crisis lost, we might just lost the entire, the realization that we have about how the urban systems or the economic system is not very sustainable in the long run. So I was thinking about one of the strategies to make sure that we do not forget or the future plans considers this experience as a very important part of the process. It would be through academic interventions. I believe that academia is rather a long-term strategist from civil society than the government agencies themselves. And I think civil society, therefore, academia has a very important role to play. So I think a global network to build a strategy about how academia or institutions or alumni like of IHS can play a role to build to bridge the gap in between academia and civil society and government, and on how to make sure that these lessons that are learned sticks with the society in long term. It becomes part of the discourse long after we get beyond this. So I think it would be a very important discourse to have. So, and one way to make sure that long-term systemic transformation can be achieved through this experience that we are all facing together. So that was a comment that I had, or a point of discussion that I wanted to add to. Yeah.
Question is one of you here trying to use the whiteboard, because the whiteboard keeps going on? If not, then okay. Yes. Is somebody trying to present something by clicking on the whiteboard? Otherwise, let's not turn that on. Yeah. Thank you.
So Justin, okay. if you want, I can share a comment about what was last said by our colleague.
Yes, please, go ahead.
Thank you, Justin. No, I was thinking about the comment, and I think it's really right. I mean, of course, it should be mandatory to taking aboard universities, for example. I do believe that the human capacity and professional capacity of the people that works in universities in different stages of their career, from the beginning, from the students, when they are students, when they are part of the lecturers and professors and all. Now, I think sometimes we underestimate their capacity, and sometimes when we are, for example, in the national, regional, or local governments, we hire these kind of international famous consultancy firms, but we also should like put the equilibrium between these kind of firms, and also to also hire universities to develop like specific studies for the projects. Because if we do that, I do believe that we are also promoting that these people will also help us in developing like projects that are feasible in our context. Sometimes you end up having these kind of large documents, no, of projects about, let's say, improving some particular urban transport means in your city, and sometimes these documents do not really fill the needs that you have. But I think the universities that are local universities should also like fill these gaps that I've been seeing in several projects that I've been involved in. So I do believe it's also a way of capacity building to take them on board, and to also have a say in the projects that the civil servants on the public sector is developing. So I do believe universities should be part of the team in that effort. Thank you.
Okay, thank you. I just have one. I'll just take this live so we can be quick about it. Just one request for Stefanie, if you're there, who's also working like Eduardo on in the system. That we have the maximum capacity of participants who are in the system. So if Abir or Shail, if you don't plan to have any more comments, if you could either remove yourselves or Stefanie could remove them, because we have a further person who wants to enter the room. Okay, and so while that's happening, I just wanted to mention, based on one of the previous comments of Stefanie about, like she mentioned, like one of the important things is civil society as a part of the partnership, and that's actually something which I just wanted to share with you, which is something that Shail and myself and our Car-Free Cities Alliance team is working on. It is a campaign where we work with civil society in different cities to basically to ask for the change, where each city can ask for the changes and the transition that it wants to see happen in the cities, and where the civil society engages directly with other stakeholders in the place. So we're calling our campaign Build Back Better Cities, and it is with the Car-Free Cities vision that we have, that we want to at least put part of that in there. So that's something that I don't want to talk about much more now, because we're almost at the end of the time, but that's kind of throwing into the mix how civil society and cities could cooperate with each other. Let's see. If there's anybody else, I've just let another person join the room. Otherwise, while he's joining, I've noticed some questions that people maybe who aren't joining, so I'll just read them aloud. Helen says, there is need to intentionally create space to accommodate the informal activities that tend to encroach on our urban mobility routes. This will also address the issue of sustainable livelihood sources for the vulnerable people. Okay, thank you. Abdul, I see you're in the room.
Yes, hi. Abdul. I am a graduate of environmental design from the University of Buffalo. First, I'd like to thank you guys for taking the time and sharing all these expertise. And then second, I was wondering if one of you could speak on this, and it's kind of a two-pronged question, is what is the role of social awareness and education in making sure that we don't fall back into our previous eras in our planning and in our transportation? And the second prong is there any research / parallels or like lessons learned in urban transportations after disasters and what we're currently seeing with Corona?
for the question, Abdul. Quite a question. Anybody can answer that or speak about that who wants to. But first, Abdul, do you yourself have any thoughts on that you would want to share?
I guess to preface, I'm seeing things like, for example, in Buffalo, New York, we have a big park in the city. They took all the lanes out. They blocked all cars. It's been used for public. It's been used for public use, pedestrian and bicyclists only. So it's kind of a concern where you're like, are they going to give it back to cars afterwards? And then seeing how grassroots organizations are getting involved to make sure that doesn't happen. And it's one of those things where it will only be successful when there's enough people behind the cause, but it brings up the question of raising awareness and education and getting more and more people involved.
Thanks. So any, either Stefanie or Alan want to mention anything about this?
Maybe I quickly comment. I think it's always a matter also of finding the right balance between push and pull. So if we take away space from the cars by, for example, occupying the space that the speaker just mentioned for walking and cycling, we need to make sure that we do provide alternatives that provide the same, let's say, service level. So I think cities could maybe convince the car users that might be, let's say, a bit hesitant to such interventions by, for example, at the same time also improving public transport services or improving new mobility services such as shared taxis or maybe micro-mobility that would also provide an alternative to go for longer distances than just walking and cycling. I think it always needs to be the right balance for people not to feel that something is taken away but no alternative has been provided.
Yeah, thanks. Yeah, I mean, I also think that and this is one thing that is also how we're designing our campaign, which I mentioned just earlier, is that there has to be a public buy-in in order for change to be successful, in order for a campaign to work. So, for example, if only the government like wants to do something, but then the citizens are not really on board, or somehow there's not a real good dialogue between government and citizens, then that might not be successful. And at the same time, if an organization or a network is trying to do something and has an agenda, it doesn't really bring in the citizens, the residents, and so forth, that will also end up, I think, not succeeding, because you need to have really broad level of support, and that's why there's no real let's say quick way to do it. I mean, developing the vision and then building like doing it step by step and getting the public on your side will take time. I mean, it's basically it's movement building, it's developing support, it's doing outreach and working with a broad level of stakeholders. So I think there's no real way to get around taking this sort of wider approach of making sure that everybody's on board. And there's also one thing which I think is one lesson, is that coming up or working with solutions or working with visions, it will require a lot of collaboration among different groups, among groups or people who are quite different from each other, who might not have worked together in the past, who might be suspicious of each other, but now's the time to overcome some suspicions and try to actually find common ground and to build a common agenda. So yeah, that's just what I would say. So there's no quick way to make sure that everything is really going to work, but it requires us all finding ways that we can do that together and then building it up slowly. Well, one of the problems when we have such questions as this one today is that there's so many aspects and so many dimensions here that we could talk about, and there are very many things that we would love to go in more depth on every different level. And I actually feel a bit bad that we haven't heard from more people. It's really nice that we had a few participants come on and discuss things. It would have been great to have more time or have done that more. I'm sorry if the three of us dominated too much at the beginning, but I think we're running out of time. We're past the hour and a half, and we don't want to lose, well, I guess we have to lose everybody. We have to stop this webinar. Is there anybody else who wants to still say something at the end before we close off? And if you do, please do keep it quick. And of course, both Stefanie and Alan, if either of you want to say a final word before we close this, you're more than welcome to.
So I'm just noticing that Justin has left and joined the room again. I just wanted to say on behalf of the Alumni Relations Office, thank you for attending the webinar. Hope to see you in one of the future ones. If you subscribed for automatically receiving updates from us, then you will definitely find out about the new one in your inbox. And for now, thank you so much. If there's anybody who would like to say something from the speakers, now is your moment. If not, I'm going to end the webinar. There you go.
Thank you, Stefanie. Well, actually, I want to take the opportunity to just thank the IHS board and alumni, and also to thank Stefanie Holzwarth, a good friend of mine that helped us a lot in this event. Thank you, Justin, Eduardo, that has left. And just to end up, I want to say that it's important to continue planning this kind of events, because I think we have a massive part of professionals that are really interested in urban issues and urban topics. And of course, urban mobility has to be one priority. I've seen in several entities that sometimes the urban planning department it's not really focused on urban mobility. And I believe it's because sometimes we do not take this topic as relevant as it should be. So I think these kind of events are part of our effort to build capacity and to mainstream things and to connect things that as important as the relationship between urban mobility and COVID-19. We cannot plan new transportation systems if we do not take in consideration health issues, for example. This is one lesson that we learned, I think, this year. Because before this year, we were planning it, of course, including it, but not as important as it should be. So I think this lesson is one of the key lessons that I think should move us forward to plan better mobility systems for the better of our cities. Thank you very much, and saludos from Bolivia.
Thank you, Alan. Anybody else? Is this goodbye?
You think? I don't know if you want to say anything, Stefanie. Anyways, from my side, thank you both for coming as guests and being part of the discussion. And of course, thank you, Eduardo, Stefania, and all of the IHS Alumni Board for making this possible. It was really nice to have you. And I think from my side, I would just say the final idea is that let us look for ways that we can really do more things together, that we can find more ways to work and support each other. And because a lot of us and a lot of people who are here today who unfortunately couldn't even hear or see are doing really amazing things and really great things in these areas. And so I think we all deserve to acknowledge and share and support each other in these things. So bye-bye.
Thank you. Bye.
Thank you.
Thank you.